Hello, and and who are you? Oh, you were booked in, were you? Today? No. Oh, no, okay. Well, I'll just introduce myself. I am Dr. Sigma's assistant. I am Nurse Chad. I'm Nurse Chad. You had an appointment, did you? Okay. Let me just have a look. I can't see anything in the diary. However, he does actually have a free slot. Someone didn't turn up. I think it was. Let me have a look. Oh yeah, Mike Hunt didn't turn up. So no, you can have his slot. That's absolutely fine. I'll just obviously need to get your details. I'm sorry this has happened. Must be a big misunderstanding. So that's absolutely fine. Yeah, yeah. No problem. So I just need some of your details, please. Yeah. So have you been with us before? You have, and I dealt with you. Did I? Okay. Oh yes, of course. You had the major problem. Yes. No, I remember the yeah, the big butt pimple. I think it was. No, it's absolutely fine. I'm assuming it's. Why did I say that so loud in front of other patients? Oh, don't worry, it's a safe space. Yeah, please don't tell anyone that. But yeah, no. So yeah, no. What's it for this time? I mean, oh, okay. So it's oh, so it's the same issue that the butt pimples have come back, have they? Oh, yeah, no, of course. Okay, so I'll just need some of your details again. I think we've lost them on our system. It's our silly system. It definitely wasn't my fault. Please don't tell Dr. Sigma. But yeah, no, I can definitely, me, myself, Nurse Chad can help you. So can I just grab your name again? Okay. Well, that is a long name. You're definitely not from here. No, that's absolutely fine. And can I just get your age as well, your date of birth? Good. And yeah, where were you born? Where are you? Where were you born? And what's your address at the moment? Okay. Okay, lovely. And what's your address as well? Just so I've got that down. I think you misheard me before. I wanted both. Yeah, yeah. You must have a problem with your ears as well, but don't worry, don't worry. Dr. Sigma will check that. And now, can I have just your email address and phone number? No, no, I'm not going to ask you out on a date, trust me. I've been with girls with butt pimples before. I will never do that again. Yeah, phone number, please. Lovely. And can I get your email as well? Lovely, that is perfect. We can definitely book you to go and see him. It'll just be about a 5-minute wait. If you don't just mind just waiting in the waiting room, he'll be with you in no time. You've gotten quite lucky here. It definitely wasn't my fault. But no, that is perfect. He'll be able to see you. Is there anything else that you want him to look at, just so I can put that down and send that over to him before the appointment? Oh, that does sound tragic. Don't worry, I won't tell the rest of the reception and I won't tell the other nurses about that. I definitely will. But yeah, no, that's perfect. We'll get that sorted and I'll pass that all over to Dr. Sigma. And yeah, just wait here for 10 minutes and he'll see you shortly. Brilliant. Can you get a glass of water, anything like that? No? You're all good? Okay, perfect. I'll see you shortly. I'll see you shortly. Hi again. Yes, no, I know it's been about an hour. Sorry about the wait. Yeah, you go through and see him. Just wait there. He'll be with you in no time. It definitely won't be me getting ready and coming back in a different outfit. It'll definitely be Dr. Sigma. Yeah. And what's my name again? Well, you're not going to report me, are you? My name's Dr. Sigma. I mean, Nurse Chad. Yeah, no. Go through. It's waiting room. Oh, what am I on about? I'm acting like I'm the nurse here. I mean, I am the nurse here. It's office number 3. Yes, yeah, just through them doors. Yeah, brilliant. Yeah, I'll see you there. I mean, Dr. Sigma will see you there. Yeah, go on. Yeah, classic Monday. Yeah, just go. Hello, I am Dr. Sigma. Yes, I'll be seeing you today. What's that? Why do I look so untidy? Oh, it's just yeah, I definitely didn't just get changed into this. It's just from the dry cleaners. They didn't do a good job. That's all. Yes, I know I do look quite similar to the to Nurse Chad. However, I am a bit more of a Sigma than a Chad. But anyway, let's forget about that. This isn't about me. This is about you. And you have needs, and we will satisfy them needs in a non-weird way. So let's get started. He's passed me over your details. And yeah, no, today we're just going to be examining kind of the nerves in your head, your face, your kind of overall body. Yes, everywhere. You know, if you'd like, I mean, I'm a Sigma after all. I'll just obviously need your consent to kind of touch your body. Yeah, okay. Well, it didn't really matter anyway. I was going to do it anyway. The forms that you sign when you first enter, it allows me to do that without consent. So, yeah, no, that's perfect. So yeah, we can definitely get this on the road. Yeah, let's get started. Now, let me find my gloves quickly. In fact, I've just got them in my pocket. These definitely are fresh gloves and not second-hand used gloves. I mean, look how professional I am at getting these on. Oh, that's the wrong way. Okay. No, this happens all the time. Trust me, every great doctor is like this. They're just so great that they get their gloves mixed around. There we go. See, there we go. Okay, let's get this second one on. The first one's always the hardest. In fact, no, the second one is pretty hard as well. This is just professional doctoring. This is just the life we live. There we go. Okay, so let's have a look at our past record, or your past record. I say our, it's your, our past record and what we need to do. Okay, so let's first just have a look at you, if that's all right. I'll just put this down over to the side here. Yeah, let's just start by having a look at you first. Okay, now I need to sort this glove out. Yeah, that'll do. Okay. Okay. Let's have a look at the face. Up here, a little bit. Let's have a look at the cheeks. Okay, and the eyes. Okay. Very nice, very nice. Let's have a look at the chin. Okay. Let's work our way down. Let's work our way down. Let's work our way down. Let's have a look at your knees as well. Very strong knees. Very nice, very nice. And we'll get some pictures of your toes. I mean, we'll look at your toes later, which I'll have to take some pictures for personal research. But no, that's fine. So we've had a look. It all looks pretty good. So we'll give you kind of like an overall examination, and then we'll give you some medicine for them butt pimples at the back. We'll try and find the reason for them coming back. Yeah, no, absolutely fine. I definitely will be taking photos of that. That is disgusting. Don't you worry. Yeah, okay, perfect. So I'll just take your temperature quickly. So let me just get you here. Lovely, and just here. Okay. Keep coming at about 36.9, which is a very, very good score, looking all normal. Just do one here as well. Yeah, 36.9. Again, that is perfect. Just throw that over there. Again, we'll just measure you up, make sure everything's looking good. Just make sure it's all. These always get so tangled. There we go. Let's have a look. Okay. Measure the face first and make sure everything's nice and symmetrical. It's all looking pretty good, to be fair. I mean, you could be a bit more of a Chad than Nurse Chad. Okay. still looking good on there. And we'll just need to use the ruler to just make sure that you're all good. It's just almost like a double check. Okay, nice. Okay, nice. Okay. Okay, nice. Okay. Okay, just the top of your head as well. Lovely, lovely, lovely. Okay, now we'll get on to the actual cranial nerve exam. Just making sure everything's all good with your body. Your body. Yeah. Okay, we'll go from there. So from that exam, we can take off that there was a lot of facial symmetry. That's perfect. No cytosis. No sign of drooping. Maybe a bit with that lazy eye, but nothing too abnormal. There was no kind of abnormal movements, which is fantastic. And can you just speak to me? Just reply, just repeat this sentence. Dr. Sigma is the sexiest man. Okay, very nice. Nurse Chad is the second sexiest man. Lovely, so speech clarity is perfect as well. That's perfect. So we've looked at quite a few different nerves there. I know I wasn't telling you at the time, but we looked at quite a few different formal testing methods. And yeah, everything seemed to be pretty decent apart from the obvious lazy eye that you have. I feel like you're looking at my face and my chest at the same time. It's pretty crazy. But no, that's perfect. We'll go on to just look at your scent first and can I go from there? Yeah, perfect. Let's go. We'll go from there. Okay, so yeah, we'll just look at your sense of smell first. It should be some kind of familiar smells to you. We'll grab our little tube here. So these are full with different scents, and then we've got a smellinator, which is also a bit of a reflex hammer here as well, which we'll use. But we'll start off with these scents here. Okay, just pick one at random. Okay. So I'll waft it just under your nostril. Okay. And what does that smell like? Coffee? That's perfect. That's brilliant. Now, this next one that I'm going to pick here will be a bit harder. Now, I don't expect you to get the actual scent, but I'd rather expect that you get just generally what it smells like. It might be an experience, things like that. It will make sense once you've smelt it. Yeah, that's perfect. Would you like again? Yeah. Perfect. Yeah, freshly mown grass. No, that's perfect. Okay, we'll do one more to make sure it's all good. Okay, this one is probably the hardest one. And I don't expect you to get it now, or maybe you'll get it in the future. No need to be scared. No need to be scared. Okay, perfect. Again? Yeah, no, of course, you can definitely do it again. Now try covering one nostril. This might help a bit. Okay, we'll try the other nostril. Close that other one. Yep. Oh no, that was juice. What kind of juice? Oh, juice. Yeah. No more questions. No more questions. I'm the doctor here. Okay. Now, I'm going to dab this into a quick liquid over here, and I'm just going to spray this over here. I want you to tell me what it smells like. Yeah, perfect. Okay, quickly. Okay. Now what does it smell like? What does that smell like? Mint, great guess, and that was the correct answer. Let's try this again. Just give me. And what did you smell there? Oh, was juice again, but you did get that correct that time. Very well done. So you are learning, and you know, maybe a bit in the future when we get to know each other. I mean, when we go on a date. I mean, and when in the future, yeah, just generally in the future, you'll know what it is. But that's perfect. That's perfect. Okay, but we'll carry on. We'll go on to kind of like a visual acuity test. Make sure your vision's all good, your eyes are all healthy, and go from there. So we'll start with a peripheral vision test. There we go. So if you just follow my finger, no, just look here actually, just look here, and tell me when my fingers leave your vision. Okay. Good. 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 There's a few more for me. Good. 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 Very, very nice. That was perfect. Now I'll just have a look into your eye, if that's okay. So just look over here for me. Just look over here. Okay, I'll just have a look in your eye. Just make sure all is good. Keep looking over here for me. Perfect. And now just look to the other side. Look to the left for me. Okay. Perfect. Just over here. Keep looking over here. Perfect. Okay. Now if you can just look down, that'll be perfect. Perfect. There we go. Good. 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 And just look up for me. Just do a quick one up there. Just keep looking up here. Keep looking up here. Perfect. Perfect. That's brilliant. Now we'll just do a quick follow the kind of, you know, follow the light test with the same light again before. Just follow that for me. Just follow that for me. Okay. Keep following the light. Keep following the light. Now it's gonna get a bit closer. Keep following it. Keep following it. Okay. Good. 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 Okay. Now I'm gonna introduce. Introduce this pen here. Now just keep looking at the light and just try and ignore the pen for me. Ignore the pen. It may get in the way, just try to ignore it. Just try to ignore it. Good, 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 good. Good, 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 good. Now just test your pupils while we're going a bit closer. Now follow the pen for me, follow the pen, just so I can get a good look. Yeah, nice. Keep following the pen, now follow back to the light. Another pen, another light. Good, another pen. Back to the light, okay. Perfect, that was brilliant. That lazy eye didn't seem so lazy, I'll tell you that. Right, we'll move to some other tests. Let me just get the equipment for that and we'll be right back. Yeah, perfect. Okay, so I've got some colours here. I just need you to tell me which colour you see. Okay, are you ready? Okay. Perfect, orange. I know that's quite hard with the difficult lighting. Let's go again. Yellow, perfect. Okay. Good. Let's try again. Okay. Green. Okay, now I'm going to mix it up. And I want you to tell me what these two colours create. Okay? A bit more difficult, but it's just getting your mind working, see how everything's working internally. Make sure you're all switched on. Okay, ready? Yellow and green. I have no idea, so whatever answer you've said, it's correct, yeah. Okay, let's try again. Green and orange. Good. Yeah, I have no idea, so we'll definitely put that to the side. But still, very good from you. And yeah, we'll move to the next. So look, just checking off kind of what we've been through. It's looking really good. So obviously the smell test did really well. With the familiar scent, you did fantastic. It was really good and positive. So your sense of smell and that olfactory is really, really positive, I will say, apart from the juice bit, obviously. Optic-wise, again, really, really positive, apart from the lazy eye. Your visual acuity was very good. The central vision test was amazing. The visual fields, the peripheral vision, that was fantastic. The pupillary light reflex, that was also really good. Obviously we shined our lights, observed kind of inside the eye. That was really good, and it showed a really good response, so that's fantastic. And yeah, we had a look at the retina and optic disc as well, and it all looked really positive. So I'll get that off. Obviously the symmetry was a bit off with them due to the laziness of one eye. One eye is just sat on the couch at the minute. But no, we're looking all good. I'll just, for the next one, just as weird as it's going to sound, I'm just going to touch you a bit, but it's not like that. It's just to make sure that the forehead's all good, the cheeks are all good, the jaw's in good shape. I'm just going to get you to clench your teeth on some bits, check the corneal reflex, get you to raise your eyebrows, things like that, smile, yeah, go from there. But yeah, let's go with that, and I'll tick it off as we go. Okay, so let me just have a quick feel up here. Okay, good. So the forehead's all good. That's brilliant. Now your cheeks. Okay, that's good. Your jaw as well. Okay, brilliant. And can you just clench for me? Okay, good. And just this side, can you clench again? Brilliant, brilliant. Okay, now I'll just get you to clench multiple times. So clench, 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 clench. Okay, good. And this side, clench, 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 clench. Okay, good. Very, very good. That's all perfect. So I'll just need you to raise your eyebrows for me. Let me just, I'll try and stop you. Just raise your eyebrows. Okay, good. Good, 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 good. Okay, now try, just close your eyes. Close them eyes. And I'm going to try to open them. Now don't let me, I'm just going to try very gently. But yeah, let's just go. Okay, very good, very good, very good. Try the other eye now, let's just go. Okay, very good. Very strong eyes you have, yes. Yeah. That's perfect. Now, if you can just smile, give me a nice teethy smile. Perfect. And now a nice teethy frown. Yes, perfect. That's brilliant. I'll just have a feel in there as well. Fantastic. That's amazing. Okay, so last couple things. Let's get that down. So just puff your cheeks for me like that. Okay, nice. And the other one. Very nice. And obviously the facial expression muscles were really good as well. That's brilliant. So I'm just going to do a quick hearing test as well. I'll keep this with me because this is obviously going to guide me through it. So I'll say some words and numbers into your ear. Just repeat it back to me, okay? Okay. 6, 7. 6, 7. Very nice. Okay. 21. 21. Lovely. That's perfect. Clavicular mogged. Clavicular mogged, very nice. Jinxie mogger. Okay, Jinxie mogger, that's perfect. And I will say the air and the bone conduction was really, really good there. The lateralization of the words was fantastic. So that's brilliant. And we did have a screen heating exam just go on whilst that was happening. Okay, so just say R for me. Just say R for me. Yeah. Yeah. Open and say R. Okay. Just observing the palate rising. It's all looking nice and symmetrical. Okay. That's brilliant. Okay. Now just do it again. Which needs to listen to the. I'm just gonna be quite close, but don't worry. Okay. Just say R again. Yeah. R. Yep. Okay. Very good. You're listening to the kind of the nasal tone and make sure the nerve function's all good. That's perfect. Okay, so I need to do some kind of resistance with you, but it should be all good. So if you can just, I'm just going to put my hands, okay, I'm going to put this down. There we go. I'm just going to put my hands on your shoulders. Now, I want you to try and shrug your shoulders, and I'm going to try and stop you, but don't let me stop you, okay? Let's go. Okay, perfect. Now we'll just go from one shoulder to the other. We'll start with this one here. Very good. I'm going to the other one. Okay, perfect. And now I'm just going to try and move your head. I'm just going to move it all. I'm going to move it up first, down, then left, then right. And I want you to stop me. Okay, let's go. So up. Okay, now down. Okay, left. Okay, now right. Okay, now I'm just going to do it all around. Just try and stop me. Just try and stop me. Okay, perfect. I can take that all off. That's brilliant. That's all fantastic. So very good resistance. Very good, obviously, turn the head against the resistance as well. And that is brilliant. There's a bit of deviation in the mouth, but it's all looking good. So what I can do now is just make sure your hearing is all good and just finish off these tests. So if you can pop these on for me, just make sure your senses are all good. These are just small little ear plugs. Okay. Sorry, I think they just fell out. Let me make a nice and snug for you, please. Yeah, no. So did you hear any of that? No, that's perfect. I definitely wasn't calling you strange names. But no, that's perfect. So I'll just give you some stuff for your problems. But apart from that, you're looking all good. So we'll give you a quick disinfectant spray. And just make sure that's all over you. We'll give you this. This is just for the cream, so if you want to bend it over, you just do it like that. Rub it in. Perfect. That's literally perfect. And just make sure it's all nice and rubbed in. Okay, and then we'll give you this cream as well. You just take this off like that. Just do that up and then just you should be all good. And then, obviously, if you don't see any progress in a few weeks, I'll provide you with these and you just snip it off. Yes, there will be some pain, but it's very minimal, I promise you. But yes, no, that's all good. I have been Dr. Sigma, and you can leave my office now, please. Oh, quickly, bear with me just one moment. Yes, I thought you were going to run off there, but no, you haven't. So no, that will actually cost you, because it was an emergency appointment. I'm sure nurse Chad made you aware. That will be £10 million, please. You don't have any money, do you? This is just a classic in the surgery. Apparently no one has any money. No, it's all right, don't worry, you can still walk out here. It's okay, just